Hello, I'm Dr. Shaylin Buck. I'm a DeKalb resident who delivered my daughter at DeKalb Medical Women's Center. It was a great experience for my family because this amazing facility and its caring staff are one of Metro Atlanta's best kept secrets, and I'm not alone in feeling this way.
I'm Teresa Parrish, and I live in the city of Decatur. I have two boys, Will, who's age 3.5, and Ben, who's 7 months. Well, DeKalb Medical is about 2 miles from our house, so it was very convenient. The thing I liked best about it were the rooms. I mean, the rooms were huge. There was a great place for, my husband to go downstairs and get coffee and snacks, and it was just really comfortable.
We do about 6,000 deliveries a year here, which puts us in the upper tier, but certainly not the biggest. So the nice thing there is we have all that any place has to offer as far as facility, but on top of it, it's small enough that the patients get the feel of being important and a person and not just an assembly line being rushed through to have their baby and see you later. You have to come see it.
My name is Amy Stanton, and I have 3 boys that I all delivered at DeKalb Medical. Living in Atlanta, there are a lot of options to deliver your baby, different hospitals, a lot of baby factories. DeKalb, I didn't feel like just another number. I really felt like a patient, and they would call me by name and address my husband even by name. And so I really felt like an individual and not just a number, which is a big deal when you're having babies.
The DeKalb Medical Women's Center has recently been upgraded, and the architects and designers took a lot of input from doctors and staff to come up with this family-centered design concept.
Simple things that you wouldn't think about that made a huge difference. For example, the way the nursing station is in the center and the rooms are around it. In the old facility, the nursing station was all the way in a corner, so they were very far removed from the patients, but now you're never more than 20, 30 feet away from a patient room the way it's designed.
I felt like the nursing staff really went above and beyond to accommodate my desire to have a natural birth.
Research has shown that the best way to increase a mom's chances of delivering vaginally are to use a doula, a birth attendant. Doulas can be helpful if a mom wants to have a natural birth, which we are all for, or if the mom wants to have an anesthetized birth, to use an epidural.
We had our children here before the building was built, and I had nowhere to sleep. Every room has a window bed that is designed to hold, I think, 6'5". So even a very tall man will have a place to lay so that he can be with his wife and child. We have the baby warming tables. Everything is hidden within the cabinets. We have mood lighting, TV, we have wireless internet throughout the hospital. We have patients able to email pictures of their baby from the delivery room to their family, and I've seen people do that right there and then.
Well, things can happen quickly in labor and delivery, and most labor goes uneventfully, and it's wonderful, and you want to be in a homey setting, and we are completely able to provide that. But if there's a crisis, this building functions tremendously well.
Even though I had my kids there naturally, I knew that the support and the staff was there for emergencies. Because even with my 3rd son, he had to go down to the special care nursery for a little while. And I felt that they did a great job and really took really good care of him.
High-risk occurrences in pregnancy are things that maybe a mom has brought with her to the pregnancy, disease states like diabetes, high blood pressure, renal disease, all kinds of things. They could be problems that the baby has. They could be genetic problems, the risk of which can go up as a person gets older. Or they can be just the moms getting older themselves. We have plenty of moms, 35, 40, 45, having babies, maybe for the 2nd or 3rd time, but often for the 1st.
Gosh, when you leave the hospital, you're so nervous. You have this new baby, and they send you home with it, and you're responsible for taking care of this new person. And with the support groups that DeKalb Medical has, it makes it easy because you get to go there once a week and talk about all your fears and your anxieties, and you're with women that have the same fear and anxiety, and with the group of you, you just come to an understanding that you are normal and your baby's normal and you're going to be fine and you'll make it through. And it was great. It was a wonderful thing to look forward to every week. They're once a week, and the breastfeeding and the support group are both free, and they actually give you a parking voucher too, so even your parking is free. So they make it really a no-brainer for you to come and and learn.
DeKalb Medical offers a continuum of care for women beyond labor and delivery services. Gynecology services are state-of-the-art too and include the capability to do robotic surgery and laparoscopic hysterectomies. Advanced high-definition equipment is complemented by highly trained surgeons and radiologists.
We offer care for women at all ages and stages of their life across the continuum of their needs, whether it's labor and delivery care, whether it's robotic, advanced gynecologic cancer care, all of that is available at DeKalb. We are very pleased and proud to be the first hospital in Georgia to offer 24/7 public cord blood banking. We do this through the National Cord Blood Program, and it's been a tremendous success, so that moms completely free of charge can donate their blood to a public bank. This is a huge service to people that will need this blood in the future, and the moms themselves have, and the families have responded very well and are very, very receptive to this opportunity.
I've had several friends who've delivered at other hospitals in the area, and the experience has not been quite as positive as mine was. Of the friends that I've had that have delivered at DeKalb Medical, they've all been positive, and they've gone back to have second and third and fourth babies there. So I think it's a wonderful place to have your baby, and I would recommend it to anyone in Metro Atlanta.
Where you have your baby is an important decision for your family, and we have every confidence that DeKalb Medical will serve your family well. To find an OBGYN that will care for you during your pregnancy and deliver your baby at DeKalb Medical, call us at 404-501-WELL for a list of referrals. And learn more from our moms by watching the testimonial videos on our website.